psychyogi.org. Today we're going to be talking about depression. I'm going to give you an outline of how we're going to talk about it. So first we're going to look at a history of depression, then we're going to look at briefly at some of the famous people who have suffered from depression. Then the risk factors and the causes, those are two different things. The symptoms, the types of depression. We're briefly going to look at the differences in the brain of a person who's depressed and that of someone who is not depressed. And then we're going to finish it off by looking at the treatments for depression. So what is depression? Again, a loose definition, but it is a persisting state of sadness with pessimistic thoughts and a loss of interest or enjoyment. And this can be in things that the person has already got an interest in. So they play guitar, but they're depressed, so they just can't do it. They just hate it now. They have no enjoyment from playing guitar because they're depressed. So, a history of depression. The symptoms of depression were first described by the ancient Greeks. Both Hippocrates and Galen thought that the human body functioned because of four bodily substances: yellow bile, black bile, phlegm, and blood. If there was an imbalance of these substances, then there would be problems. Now, although this is 100% wrong, it's actually very similar to what we think now about the brain with neurochemistry. So if you have an imbalance of this, then this can happen. So they're wrong, but they were sort of on the right track, which is pretty amazing for over 2,000 years ago. Hippocrates and Galen described the depressed person as someone who was gloomy, pessimistic, anxious, prone to hide away or take flight and avoid things. They were sleepless, irritable, and they were prone to outbursts. They believed that depression would occur when there was an excess of black bile in the person's body. Now, aside from some of the other ancient Greeks who did propose that the brain was the root of everything, but they weren't really taken seriously, Descartes was the first person to propose that there was a distinction between the mind and the body. This is known as Cartesian dualism, and it sort of paved the way for modern psychology and psychiatry. So when Emil Kraepelin came along, he was a German psychiatrist, he could use the brain as a sort of starting block to understand certain behaviours. So he furthered the notion that the brain is the root of emotion and behaviour. And the way he did this was he studied patients who had brain injuries, and when he did this he also created a classification system, and this is one of the things he's very famous for, because he was the first person to identify obsessive compulsive disorder and manic depression, which today of course is more commonly referred to as bipolar depression, which we'll get onto later. So now let's look at some of the famous sufferers of depression. There aren't many of them, but I didn't want to bore you with just a list of people. Tchaikovsky, who was famous for, well, actually it was sort of after his death that people hypothesised that he may have suffered from depression. Winston Churchill, Prime Minister of England during the World War II. Edgar Allan Poe, very famous and gloomy poet, wrote The Raven. Abraham Lincoln, which was one which surprised me. I didn't know he suffered from depression. Okay, now let's look at some of the risk factors. Of course, risk factors are not causes in themselves, but they can increase the chances of a person becoming depressed. I must stress the point that there is not one single cause for depression, nor is there one single cure for depression. Because it's psychological, there can be a number of causes. Someone can have a genetic predisposition which can be affected more by certain things than other things. So, for example, a lack of sleep. One person may be really affected by this and get depressed if they don't get 8 hours sleep a night. Another person could live totally fine for the rest of their life on 2 hours sleep a night. There are a lot of individual differences which have to be accounted for with depression, which is why it's so hard just to say this causes this. It's not like a virus. You could say this virus is caused by this thing here. We know it's caused by this because this is the thing, and we've reduced everything to this. We know it's that. We can't really do that with psychology. So gender. Females are far more likely to experience depression than men. Around twice the amount of women experience depression when compared with men. The statistics indicate that around 25% of women and 12% of men experience serious depression at some point during their lives. Now, one of the proposed reasons for this is not biopsychological or genetic, but it's a cultural and social explanation. The reason is because men are more likely to bottle away their feelings because that's the manly thing to do. You're not meant to cry or tell anyone about your problems if you're a man. But with women, they're far more likely to seek help and treatment, so they'll talk to their friends about it. Their friends will go, well, that's not right, you should do this, go to a doctor, go to a therapist, etc. So that's maybe a reason for the statistics, which may suggest that there isn't actually a difference between men and women, just that we know more women have depression because they seek help. An alternate explanation for this is that women have more frequently changing hormones, and that these may have an impact on the rates of depression witnessed in women. Age. Now, age is a risk factor, but it's a very limiting one. It can be the entire almost cause because of things that happen during a life. So teenagers are the most at risk of depression because of their developing brain, and what happens is there's a misbalance of neurochemicals in the developing brain. And then from the ages of 20 to 50, the risk of depression is less than teenagers, but around 3% of the population in this category will be affected by depression at some point during their lives, or during that age range. At age 65, the risk of depression increases somewhat, and this is attributed to two things. In men, particularly, it's attributed to a lack of testosterone. When men reach age 50, typically, they stop producing as much testosterone, which can create depression. Obviously, 65 is the age where people stop working. So there's a lot of research to suggest that being meaningfully employed is a great preventative measure to depression. Friesen Moore, 1987, conducted a longitudinal study of blue-collar workers over the age of 45, some of whom have been unemployed or re-unemployed, and it was found that unemployment is linked with depression, a lack of hope, and financial problems. Marital status. So marital status can lead to increased rates of depression when it's an unhappy marriage or the person who's divorced. Then their chances of depression increase. Whereas those who are happily married are less likely to experience depression. Genetics may play a role in the development of depression, especially if a person has a family member who suffers from depression, then their chances also increase. This suggests that there is a biological root of depression and that the other factors are in fact epigenetic. So they are there, the person may have a genetic predisposition to depression, or it's influenced by the environment. They have to have that biology, in other words, but that's not conclusive, it's just an idea. So some of the causes. I've tried to separate them into their assumptions. So cognitive thought patterns. Having thought patterns which are negative can cause depression and are often mistaken as a symptom. They will be a symptom, but sometimes people mistake them as a symptom after the person has already got depressed. It may be the thought patterns themselves which have caused depression. So let's look at a depressive thought pattern. So I'm doing this, but this has no purpose. Therefore, I have no purpose and the world is meaningless. This is a classic depressive thought pattern, and what is thought is that people who think like this can actually affect neurological changes in their brain. So there's something called neuroplasticity, which suggests that the brain can actually change itself. And the best example of this is learning. If you learn something, a change has occurred in your brain. But what has been thought is that when people think badly and are pessimistic, that their brain will stop producing certain chemicals which can then actually create true depression in their brain. Now this is quite strange because now we see that your thoughts can in fact influence your biology in a sense. So if you remember the video about the optimism bias, you remember that people who are optimistic tend to not get as depressed as other people. If people have the pessimism bias, where they think everything in a negative light, which is what people who are depressed do, they're more likely to become depressed. Okay, Martin Seligman noted the link between learned helplessness and depression. Now I've set this one as cognitive and behavioural, which is weird because if it's behavioural, it's unlikely to be cognitive. But this is one exception, because although it was discovered by a behaviourist, Martin Seligman, it actually is cognitive as well, because the person learns that they're helpless and then they can develop cognitions about this and think, well, last time I tried that, I failed, so I'm going to fail this time, and there's nothing I can do about it. And it's also associated with the persistent punishment, but that isn't actually consistent. So if you try really hard for an exam and you fail it, you think, well, this isn't fair. I haven't succeeded here. And then maybe you don't try as hard and then you don't fail, you don't pass still. So you sort of learn that you can't pass this, learn helplessness, and that can cause depression because you think you can't do anything about it. So you can even think of your friends in here, because you're likely to have a friend who thinks everything is worse than it really is, whereas others may think that it's better than it is. And these are the cognitive patterns. So the top two link together. In fact, the top three link together as well. So if you recall the video I did on locus of control, those who have an external locus of control are more likely to experience depression because they believe that they are not in control of events in their lives. Whereas those who have an internal locus of control believe that they are in control of everything in their lives and thus less likely to get depressed. So this again links back to learned helplessness. If you think that there's nothing you can do about something, you're more likely to get depressed about it because you might not want it. So if you don't want to be in the job you're in, but there's nothing you can do to get out of that job, you feel trapped and you're thinking, well, this isn't my fault, I haven't done this. Then you've got an external locus of control and you're more likely to be depressed about it. Whereas someone who has an internal locus of control, even if they blame themselves and say, well, this is totally my fault, and they still conclude that they can't get out of the situation very easily, they're still less likely to be depressed. Okay, now if we look at biological, neurochemicals. Imbalances and deficiencies in neurochemicals and neurotransmitters are largely at the root of depression. Other causes, and in many cases cause differences in neurochemistry, which in turn causes symptoms of depression. There are at least 3 neurochemicals that are associated with depression: serotonin, norepinephrine, and dopamine. There are others, like I've mentioned, testosterone, but some of the others aren't quite as conclusive. They definitely have something to do with depression. That much is concluded. So having a deficiency in one or a combination of these neurotransmitters can cause depression. Serotonin is used in the regulation of many bodily functions, including eating, your sex drive, and sleep. When there is a deficiency in serotonin, these things aren't as well controlled, and the person afflicted can often feel depressed and even suicidal. Norepinephrine, also known as noradrenaline, is known to help us recognise stressful encounters. And when it is lacking, we may struggle to react to stress accordingly and become depressed from that. Dopamine plays a large role in the brain as it motivates us to seek out rewards and pleasure. When there is a deficiency of dopamine in the brain, then these rewards mean less to us and we can lose hope and become depressed. Interestingly, these neurotransmitters are also associated with happiness and sleep. Which brings us on to our next point, environmental lack of sleep. Having a lack of sleep can also cause depression because sleep is a restorative process. Having a lack of it can lead to the body becoming exhausted and not being able to function properly. A lack of sleep will cause an imbalance of neurochemicals, which, as just mentioned, can cause depression. Now, the next one's nutrition. While a lack of appetite can be a symptom of depression, not eating properly can be a cause of depression. Rao et al. 2008 suggests there is a tangible link between nutrition and depression. Poor nutrition can cause depression. For example, in their sample they found deficiencies of omega-3, vitamin B and magnesium in depressed patients. Addressing these deficiencies with changes to the patient's diet help cure the symptoms of depression. The first and most notable symptom of depression is, of course, sadness and a loss of hope. This can be terrible and can lead to suicidal thoughts. Anhedonia is one of the symptoms of depression, which I know I've done a video on it before. This is when people cannot experience joy and happiness, even at the happiest occasions, as a result of depression. A person could win the lottery and still feel sad if they are depressed and have anhedonia. People who are depressed are more likely to get ill than other people because symptoms of being depressed is a weakened immunity, weakened immune system. In fact, there's an entire field of study which considers the effect of the mind on the body. This is called psychoimmunology. A loss of energy is another physical symptom of depression. People who are depressed will often completely feel drained of all energy, even after they've slept. Which brings us on to the next point, sleep. These people who lack in energy because they're depressed often fail to sleep or have a disrupted sleep pattern. This lack of sleep, as mentioned before, can cause depression because of the imbalance of neurochemicals and neurotransmitters. When a person is already depressed, this can make the depression even worse and lead to suicidal thoughts. Psychosomatic symptoms are physical symptoms that manifest themselves without physical cause. For example, people who are depressed may start to have back pain without actually having anything wrong with their back. This is a very strange symptom to have because we know there's nothing wrong with this person's back, but they have back pain. They're not lying about the back pain, they really do feel it, but it's just because they're depressed. People who are depressed may also be overly anxious about small things. However, it can be greater things, and this can even be the root cause of depression itself. For example, money worries. Financial problems are a huge cause of depression. Let's look at the types of depression. Major depression. Major depression has a number of names ranging from unipolar depression, clinical depression, or major depressive disorder. This is by far the most common type of depression, and the symptoms usually last for a few days to a few weeks. Persistent depressive disorder, also known as dysrhythmia. This is when the symptoms of depression have lasted more than 1 to 2 years. So it's essentially major depression, just long lasting. Bipolar depression. Like we mentioned earlier, this was originally identified by Emil Kraepelin and was originally called manic depression. The symptoms of bipolar depression include uncontrollable mood swings from the peak of happiness to the lowest depression, and people often report liking having bipolar depression because it makes them who they are. So a famous person who has bipolar depression is Stephen Fry, and he did a documentary on that. Also, I think Robbie Williams was in there, and Princess Leia from Star Wars. I don't remember the actor's name. But yeah, this is when people go from being high to being really low, but it doesn't happen instantly. It doesn't happen every 3 minutes. It may happen over the course of a day, but it's not so jumping around like a lot of people tend to think. Antenatal and postnatal depression is depression experienced by women during and after pregnancy. Around 10% of all pregnant women have experienced this type of depression at some point during their pregnancy. This may also account for the increase in women's depression from the statistics. Melancholia is a severe form of depression, with the notable symptom that the person afflicted will move slower than normal people and will appear almost completely drained of energy. Anhedonia is common with this form of depression. The person will experience no joy whatsoever and be completely depressed almost all the time that they are suffering from melancholia. Psychotic depression is a combination of both depression and psychosis. This can be awful for the person afflicted because alongside the experience of having depression, they can also have hallucinations. Now, hallucinations may not just be visual, they may be auditory or olfactory, so smell. They may smell things that aren't there. Psychorhythmic disorder is a very similar disorder to bipolar disorder, but the symptoms are less severe. The jumps between highs and lows aren't quite as separated. Seasonal affective disorder. This is a mood disorder which is affected by the seasons and includes depression in its symptoms. The depression-like symptoms are often more pronounced in the winter because of the darker days and the less exposure to sunlight, which can lead to a vitamin D deficiency, and this can cause depression. Let's have a quick look at the differences in the depressed brain versus the normal brain. So these are two PET scans, positron emission tomography. It basically uses radiation to see what happens in the brain. You can see the areas of the brain which are either black or blue are areas with low or no activity. If it's black, there's no activity there at all. That's where it looks like there's a hole in the brain, in the depressed brain. The hotter areas, the white, orange, red, yellow areas, these are areas that have more activity. As you can see, the depressed brain overall is a lot less active than the non-depressed brain. And here we can see the difference in blood flow and brain metabolism in a person with chronic depression and a person who is healthy. Note the difference in the prefrontal cortex. There's a lot less blood flow there. Okay, treatments. Now, remember we've been talking about a condition of which there is not necessarily one cause. Like I mentioned earlier, there is not necessarily also one cure or treatment. What works for one person may be less effective for others. The most effective ways of treating depression are typically a combination of psychotherapy and drugs. However, there is some evidence to suggest that the combination of therapy with drugs is no more effective than the use of drugs alone. And that's Karp and Frank 1995 that suggests that. So let's look at cognitive behavioural therapy. This is quite an effective means of treating some types of depression. Recall earlier that we talked about the different thought patterns of depressed people. Cognitive behavioural therapy assumes that these thought patterns are at the root of depression. Therefore, the aim of cognitive behavioural therapy is to change these patterns. For example, instead of thinking, what's the point of this, the person should think, how nice this is. I'm not in pain, I'm quite warm, I've got a nice drink, I've got something to eat. This is quite good. Whereas the person who is depressed, of course, will be thinking, well, this food is, I don't really care. There's no point in this. Why am I eating this? That may be what they think. And cognitive behavioural therapy aims to change those thought patterns. Selective serotonin reuptake inhibitors are drugs which prevent or at least slow the reuptake of serotonin, which makes the effects of serotonin more potent, which is needed in the depressed brain. The most famous example of this drug is Prozac. Basically, what happens in the brain is one neuron sends serotonin and that gets flooded out, and then part of the neuron will pull that back in and reabsorb it. That's called reuptake, and this is what those drugs prevent, because it then makes the drug more potent. Well, actually, the neurotransmitter. The drug makes the neurotransmitter more potent. Group therapy. This aims to reduce depression by giving the depressed person a supportive environment and a group of people which they can talk to and interact with. Typically, the groups will have between 4 and 12 people in the group. One of the biggest benefits of this therapy is the combination of the social aspect and the structure it can bring to the depressed person's life. Remember, a lot of depressed people are unemployed, and that's one of the reasons that they become depressed in the first place. It's also less formal than a one-to-one patient therapy. In group therapy, the members of the group are encouraged to talk to each other about their ideas and offer each other solutions. So a person might say, well, I'm feeling bad because I don't have a job. And they say, well, I didn't have a job, but then I volunteered somewhere. I still didn't have a job, but I have, at least contributed. Behavioural therapy aims to find the root causes of the patient's depression. Behaviourism is the underlying theory behind behavioural therapy, and the therapist assumes that the depressed patient is not getting enough rewards in their life, and that's why they're depressed. For example, they may want to learn more, but they don't have the time. So what the therapist would do is they'd aim to help the patient manage their time more and therefore learn more, because they have more time to learn more. And therefore the reward they would get the reward of learning. In behaviourism, things can either be rewarding and reinforcing, so something that's good, you're told by your driving instructor, that was a good drive you did there, very good. That was a little reward, whereas a punishment is having to pay a speeding fine. That's a punishment, and it's aiming to prevent you speeding in the future or parking illegally. But these rewards and punishments can exist everywhere in life, and when we want to do something, we feel rewarded when we accomplish that little thing. And what behavioural therapy says is, well, this person isn't getting enough of that reward. They're not being reinforced enough. So we need to try and increase that. What do they want to do? What don't they have enough time to do? Here's what we can do. We'll try and move it so they can do more of it. It may be that they want to, be better at socialising with people. So what they'll do is they'll work with them to increase their social skills, and then they'll increase their rewards because they now can socialise better with people in groups. One of the key methods of behavioural therapy is monitoring the patient's behaviour to understand where the problems lie. For example, the therapist may note that the patient gets on the bus every morning, gets annoyed because the bus is always either late or full, so the therapist would suggest using a bike, which will prevent the therapist getting annoyed, and it would increase the amount of exercise that they are currently doing. Which brings us on to the next point, exercise. Exercise is a very effective way of treating depression. In fact, increasing the amount of exercise a person does by just 3 hours a week can drastically reduce a person's depression. Although the exact reason for this change is not 100% known, researchers believe that exercise induces an increase in those 3 neurotransmitters that we talked about earlier: serotonin, norepinephrine, and dopamine. Increase those, you prevent depression. Or that's what the theory says. If you've enjoyed this Psych Yogi presentation, why not subscribe to keep up with all the latest videos?